Hello, my name's Kate Davis and I'm an independent fertility nurse consultant. I'm going to talk to you about IVF and what to expect. So the term IVF, or in vitro fertilization, actually means fertilization of the egg outside the body. And I'm going to explain that process step by step. When you're thinking about how long an IVF cycle takes, well, first of all, there's no one IVF cycle. Everyone is individual. So how I'm going to talk through the cycle is giving you a general overview. But it can take anywhere between 3 to 6 weeks, depending on your protocol from your clinic. But like I said, this is a general overview. So things do change and different steps might happen as a result of your own particular needs and your medical history. So it's just going to give you an idea of what to expect, which is really important because if you can understand what to expect, it's going to make the process a little less scary for you and make it seem less overwhelming. So if we start off at the beginning of a cycle, you'll be asked to call your clinic on the first day of your period. And this is when normally your treatment would start. It might be that prior to that, you've had some investigations and some scans, but on day one of your cycle, your treatment will start. And it may be also around that time as well, you'll have other scans to check that everything is working and going in the right direction. So it might be then that you have some stimulation, and this will be by medication, normally hormonal injections. And these drugs are generally administered and you'll be into your abdomen, and you'll be taught how to inject these by yourself at home. They're very, very easy to do. The needle is very fine and you just go in at an angle, so you're not going directly stabbing in. So it's nothing to be too concerned about. But I do appreciate it takes a little bit of time to work out how to do this. You might feel quite anxious. You may have never have handled a syringe and needle before. So your nurses in the clinic will explain everything to you. And there are also lots of videos that you can look and find online as well to show you how to do this, to take the process or the anxiety away from the process a little bit. Before you get your medication, you might want to clear a space in your fridge so that you've got plenty of room for all your medication that you can store safely in the fridge. Maybe go and buy yourself a little Tupperware box so that you can keep it all away from foodstuffs. So you'll start your medication, and this will help to stimulate the follicles. And what we're looking for is to stimulate lots of follicles rather than just one follicle, which you would have on a natural cycle. And then 36 hours before egg collection, so where we're going to collect the eggs, then you'll be given another medication, which is called a trigger shot. And this is help mature the follicle to the desired state. So then you're being monitored all the way through this process with lots of scans just to see how the follicles are growing. So your doctors will know exactly when you need to start your trigger shot. Then after your trigger shot, about 36 hours later, you'll be called into the clinic for egg collection. And the egg collection is under local or general anaesthetic. And then your eggs are taken away and placed in a culture medium in the laboratory and incubated. So during this time, the procedure itself it can be a little bit uncomfortable. So it's worth taking some nice comfy clothing to put on afterwards. Take somebody with you for company, but also when you wake up from your either local or your general anaesthetic, and sometimes we use something called conscious sedation, you might be a little bit confused, a little bit forgetful, and you might not necessarily remember everything the doctor's told you. So it's really important to take someone with you, because the most important thing that you want to know at that moment is how many eggs did you get? That's what you want to know. So it's worth having somebody with you so that you feel comfortable, but also so that they can remind you of perhaps the things that your consultant has said that you might have forgotten. So then if you have a partner, then your partner will produce sperm, or you might be using a donor sperm. And then in the laboratory, the embryologist gets the egg, gets the sperm, and puts egg and sperm together. And this is then to allow natural selection for the sperm to find the egg and to penetrate through the egg. And it might be that you've got more than one egg, and therefore you're hoping to get more embryos. If you've got lots of eggs to play with and lots of sperm, then you can hopefully get lots of embryos. So after that's happened, then the embryologist carefully looks after your precious embryos for about 3 to 6 days, and they become your new best friend, because they're probably phoning you up every day to give you an update on how your embryos are looking. So what we're wanting to see is the embryos dividing, so they're going to become good quality embryos. So your embryologist will be telling you all of this. And then normally, between day 3 and day 6, you'll be invited in for, if you're going ahead with a fresh transfer, to have an embryo transfer. If you're going for frozen, then once the embryos have reached the desired state, then they are frozen in the freezer for you to use another time. But if you're going for a fresh transfer, then you are asked to come back into the clinic for transfer day. Now, this is a really simple procedure, unlike egg retrieval, which means that you're having some either conscious sedation or anaesthetic. This doesn't happen with the embryo transfer, so you're free to go about your daily routine afterwards. With the egg collection, you would want to go home afterwards, and you might want to take a day or two off afterwards if you're feeling a little bit sore. But with the embryo transfer, it's dead simple. You go in, one embryo, potentially two, depending on your clinic, is selected and transferred into the womb. In the UK, we tend to recommend only one embryo is transferred at a time. But it's a very quick and painless procedure. It's done with a very fine plastic tube, which is inserted through the vagina and into the cervix. And then the consultant is looking very carefully with ultrasound guidance to make sure that the embryo is put in the correct place. And then comes the 2-week wait. So this is the really difficult time when the embryo has been transferred and you are literally now waiting for Mother Nature. It's a difficult time. It might be that your clinic asks you to do a pregnancy test 10 days after embryo transfer, so be guided by whatever they say. But it tends to be known as a 2-week wait because it's that wait to see whether or not you have conceived. So normally your clinic will suggest that you do a pregnancy test at home, and it's ideal to do it on the first sample of urine that morning. So I always recommend laying everything out the night before, getting your pregnancy test ready, getting your pot ready to pee in, and having it all there. So when you wake up in the morning after probably not a lot of sleep, let's be honest, then you can do your pregnancy test and see whether or not it's been positive. In some circumstances, your clinic may suggest that you come into the clinic and have a blood test done as well. So if you're going through IVF at the moment or about to start, I wish you all the very best of luck. And I really hope that this video has helped give you a bit of an understanding of what to expect, which will ease the process for you. Best of luck.